What research are you working on at the moment?
My main interest currently is really treating patients with deep vein thrombosis with interventional therapy, trying to prevent long-term post-thrombotic syndrome. But I'm also involved in more basic studies on looking into the mechanism of cancer-related thrombosis, particularly the importance of TFPI and factor V, but also not only why these substances are actually triggering thrombosis or maybe involved in triggering thrombosis, but also how they can be involved in the development of the cancer. So it's a dual relationship between cancer and thrombosis.
Thrombosis and cancer, which should be treated first?
Well, when patients get a cancer, of course, the most important issue is to treat the cancer. That's what it's all about. But of course, thrombosis is an important complication of cancer. And as we know, since thrombosis is an important complication, and also it seems that is an important prognostic factor, it's important to elucidate the role of thrombosis-related complications in cancer patients.
Where are future advances in this field directed? Will research focus on the clinical or the drug side?
Well, I think the most important achievements will be on the therapeutic side, because the question is whether we can develop new targets. First of all, whether we can develop targets that interfere with coagulation that could be important for the development of the cancer disease, not only for prevention of thrombosis, but also for the development of cancer.
As a prominent member of the ICTH, you have a broad view of what's happening internationally. How do treatment strategies differ in different regions of the world?
Well, there has been a number of achievements during recent years with the development of the direct-acting oral anticoagulants, DOACs or NOACs. So we are sort of in an intermediate phase, but definitely I think the possibility to interfere with the intrinsic pathway of coagulation is quite interesting. So that's, yeah.
What is your opinion on real-life observational studies and registries?
Well, we are actually working on that. So I think that's a great new methodology. So in Scandinavia, we have a number of registries where we actually randomize within the registries, and that's a very good way to perform and follow up the patients, to perform new studies. Particularly, I'm working on interventional treatment of DVT, and we are building up a new registry where we want to randomize within the registry for the new procedures, because there are a number of interventional procedures that are being performed, and they have never been proven or confirmed that they are efficacious and safe in clinical studies. So the registries, they will facilitate doing such studies.